Hey, greetings, friends. This is Selah with Whole Family Medicine. Rather than writing out a really long email newsletter with all this information, it's just so much easier for me to express myself verbally. And hopefully, you can turn this on and listen to this um, while you're cooking dinner or something like that. You certainly don't need to watch it, there's nothing really to see. Except for me doing lots of hand gestures. So I wanted to make this like the best of 2024. Like what am I doing now that I wasn't doing a year ago? Updates, things I've been passionate about, things that I've found that have been really inspiring for health and health optimization and healing in the last year. So if you haven't tuned in with me recently, or maybe we've been working on other things, this is an opportunity for you to know kind of other avenues of support to receive from whole family medicine. And I guess I should just start by also saying, like, if you don't know yet, we've got two people working on the team beside me this year, which is really awesome. Christine joined us in July, initially as an administrative support, although being a registered nurse, and now she's moving into clinical support, and we'll be doing follow-ups with people and things like that, just making sure that everything that we have created and instituted for you with your plan of care is working in real time. And Ivy has joined us as well, picking up the pieces of the admin work that Christine is passing on to her. So if you get emails from them, just know who they are and that they're here to support you as well. Okay, now back to the best of 2024. So one of the first things that I started diving into early in January and February of this year was looking at oral health, sleep health, proper jaw development and tongue placement, and attention and sleep issues kind of all rolled into one, right? So if someone were to say to me, I have TMJ, I grind my teeth, my kid flops all over the bed all the time, I'm always stuffed up and I'm breathing with my mouth open all the time. People who are waking up feeling exhausted after a night's sleep, or people who are having focus issues, especially children, we always want to evaluate for mouth breathing. Okay, so you might not be like this. You might just be simply like this, a simple opening in your mouth. But when you are not talking, or if you're not communicating with someone verbally, if you're not talking, your lips should be sealed, even especially if you're chewing your food, right? So we need our lips sealed, nose breathing all the time unless we're talking. And so, this is a whole rabbit hole you can go down to, but one of the biggest things to understand is that the placement of the tongue in the mouth is really important. If you say na 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 and you put your tongue on the place in the roof of your mouth where your tongue touches when you say na 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 na, that's where the tip should rest, and then it should be suctioned to the roof of your mouth like this. So if you're watching, okay, that for a child is a big deal because that's going to expand their palate appropriately as they grow so that they don't have teeth crowding. They probably won't need their wisdom teeth removed. They won't need braces. They're going to have less cavities and things like that. Okay. If you are mouth breathing, you're going to get cavities. You can brush your teeth all day long. The oral microbiome is going to be thrown off from all of the air. It's going to dry out the positive microbiome, and you're going to have cavities and dental caries. You may close your mouth all day long during the day, but sleep with your mouth open, and the same thing is going to be a problem. Okay. So, what do you do about it? Myofunctional therapists are available in this area and by Zoom and other places who can do exercises. You can be evaluated by them to see how your bite is, see how crowded your mouth is, where you need work, even with the way that we swallow. A lot of times we swallow incorrectly. So this is just an avenue to really optimize ourselves, especially for our children less than 12, because that's where we can catch them. If you have any thought that your child might have a tongue or a lip tie, it's something to discuss. And also it's important if you have a baby and that you're opening the jaw and resetting, closing the lips, and encouraging nasal breathing as a pattern. So if you have a little one, like less than a year old, this is an important thing to be paying attention to. There is an aligner system that can be used to help to widen the jaw, with or without myofunctional therapy. And that's called Smart Start aligners. I'm still trying to identify folks in a reasonable area, vicinity of our Asheville area who utilize this protocol. So that's one thing to think about. And of course, sleep apnea as well is another concern. And there are mouthpieces that go with sleep apnea. Adults can also use these aligner systems, but I think it's easier with children. So just one first thing that I wanted to share about. The next thing I want to talk about are a couple supplements that are often overlooked or sort of like undervalued or maybe confused. So melatonin. People either love it or they're scared of it. They don't want to become dependent on it. So I wanted to give a little education on melatonin. We actually have a product called Herbatonin, like Herbatonin, that's available through Fullscripts. Members can get it for like $12 to $15 for 120 caps, a little bit more for non-members because you all have a different discount. But I wanted to talk about the 6 functions of melatonin, okay? So it's a transformer. It's a hormone that can flex into an antioxidant. It's water and fat soluble, so it can act in multiple environments in the body. It's 2 times as effective as vitamin E as an antioxidant, and 5 times more effective than glutathione in neutralizing hydroxy radicals like free radicals in the system. Glutathione is something that our liver uses in the detoxification process if you're unfamiliar with it. And it is something that many of us probably should be on, or an acetylcysteine, which I'll talk about in a minute. Okay, glutathione also, it stimulates the production of dimutase, glutathione peroxidase, and glutathione reductase. So it stimulates the production of glutathione, which we need, and we all use a lot of it if we're doing a lot of detoxing. We use it at night and we need these things at night when our reactive oxygen species are the most highest in the body. Okay, it's an anti-inflammatory agent. That's why it was used in the COVID treatment that the Frontline Critical Care Alliance put forward in the early 2020s. It is protective for the aging brain. It promotes nerve health and neuroplasticity. It's antidepressive and anxiolytic, so it's antidepressive and anti-anxiety. Okay, it can be neuroprotective in specific diseases that are where there are known neurotoxins, and can protect and maintain immune cells. Okay, so already a lot more than just putting you to sleep here. It's a virus buster. It can block viral transcription. It's known to be beneficial in cancer, autoimmune, and neurodegenerative conditions. And it is a chronobiotic. It sets the circadian rhythm. It is not a hypnotic. So we are not putting melatonin next to Lunesta and Ambien and all the other like sleep medicines. And it's also a mitochondrial regulator. And later I'm going to talk about the cell danger response and why our mitochondria is so important to why we get better and why we don't get better when we're dealing with multiple assaults on the body. Okay, so potential points of leverage for melatonin. If you have headaches, autism, eye disorders, ADHD, dementia, if you have hypertension or metabolic syndrome, that means that your body is on its way to diabetes and having trouble processing sugars. Reproductive and fertility support, especially in PCOS, polycystic ovarian syndrome, and endometriosis. It's also good for gastroesophageal reflux disorder, ulcers, and irritable bowel syndrome. And it can be supportive in multiple sclerosis, Hashimoto's thyroiditis, COVID, oxidative stress from extreme athleticism. That means you are like training for the Olympics and you actually are getting oxidative stress because you're working so hard. And the oxidative stress load from cancer. Okay, and it also has some merit in osteopenia as well. So some tips about melatonin: go for the lowest dose for the shortest duration. And what I mean by that is actually just go for the lowest dose. So we don't want like a melatonin lasting into the day. We don't want you to be groggy or anything like that. I'm using 0.3 milligrams, so 0.3, a third of 1 milligram as my dosage. Herbatonin makes a 3 milligram and a 0.3 milligram. And what I find when I take this medicine is that I sleep deeper and I wake up feeling more refreshed. And I take it some nights and not other nights. I forget to take it a lot of nights. But the nights that I do, and I'm nursing a baby and sleeping with a 3-year-old, I'm feeling more able to get up in the morning with them. So it's been very helpful. And yeah, I think I just want to mention that herbatonin specifically, which is a phytomelatonin, is 300% more potent in its antioxidant capabilities and 470% increased in its free anti-radical activities and 646% more anti-inflammatory than, these are all compared to your average melatonin. Other things you can do to help melatonin help you get adequate darkness at night, reduce artificial blue light at night, get adequate protein throughout the day, eat food sources that are blue light protective food sources and food sources of melatonin, and take melatonin itself. So melatonin is one of the supplements I wanted to talk about. I also wanted to mention Saccharomyces boulardii. This is a probiotic yeast that has been researched for its beneficial effects on digestion. I came to know about it because it was really good for ending a spell of diarrhea, right? So I've had diarrhea for a couple days, take away Saccharomyces boulardii, and all of a sudden I'm not having diarrhea anymore. Okay, so it's a non-pathogenic yeast strain. So it's not going to give you candida or anything like that. But it also has some really awesome other effects. This is also, these are fairly affordable supplements. Also, I want to note that as well. So things that are low-hanging fruit. You can get 180 caps for $28 through FullScript for members through the Jarrow brand, okay? So let's talk about some of the benefits. We talked about supporting gut health and restoring balance. It can reduce the pathogenic bacteria growth and yeast growth in C. difficile, E. coli, and candida. It also prevents dysbiosis by populating the gut and taking up real estate with a good bacteria and not letting a bad bacteria come and consolidate. Helps prevent and treat diarrhea. We talked about that. We talked about it protecting against C. diff, treatment of irritable bowel syndrome, and it can manage irritable bowel disease, which is ulcerative colitis and Crohn's disease. So something you could add to your repertoire. It improves gut barrier function. Ever heard of leaky gut? That's when you have long-term inflammation in your gut and the lining of your intestines starts to get really kind of puny and inflamed, and it's letting molecules that are too large out of the lumen of your small intestines and out into the bloodstream. So now all of a sudden you have foreign proteins in your bloodstream. And why are you achy? And why do your joints hurt? And, why are you feeling like just kind of generally like fatigued and ick? This is things that happen when we get leaky gut. So we want to have a strong intestinal barrier. Also, Saccharomyces boulardii enhances immune response. Okay, so really cool. The one, medicinal mushrooms have two beneficial constituents chemically that we rely on to use them. Well, Saccharomyces has one of those, and I think it's the beta-glucans. I don't have the note right in front of me right now. But my notes here say that it regulates immune responses by reducing pro-inflammatory cytokines, and it also increases the production of secretory IgA, which is really the immune system in the gut. So it also supports candida and yeast overgrowth management, helps with small intestinal bowel overgrowth or SIBO, reduces symptoms of lactose intolerance. It can help the digestion of lactose by supporting the production of digestive enzymes and promoting the growth of beneficial bacteria. It also assists in weight management and enhances the absorption of nutrients. It can even help improve your skin conditions that are happening as a result of dysbiosis in the gut. Very effective and safe for the use of children. So just wanted to speak about Saccharomyces boulardii. And looks like two more that I want to talk about. One was N-acetylcysteine. I mentioned that when I was talking about glutathione. Premier Research Labs has an N-acetylcysteine that has milk thistle, turmeric, and green tea extract in it. It's you can get 60 caps for $10, $10 or $11 for members. So it's Premier Research Lab brand. So specifically talking about the synergistic benefits of combining NAC, milk thistle, turmeric, and green tea, this is a product for the liver. This is a product to support the liver detox process. Okay, so of course, enhanced liver detoxification. NAC provides the raw materials to make glutathione. Milk thistle enhances glutathione activity in the liver and protects liver cells from damage. Turmeric adds anti-inflammatory and antioxidant support, further improving the detoxification process. And of course, green tea contributes to liver health by improving liver enzyme levels and acting as an antioxidant. It's also an inflammation reducer. Both turmeric and green tea are anti-inflammatories. It's an immune support because NAC helps boost our immune function by enhancing those glutathione. And also we've got the anti-inflammatory effects of the green tea and the turmeric. Respiratory mucosal health. NAC is effective for improving respiratory health by thinning the mucus and supporting lung function. Metabolic and cardiovascular health. Green tea supports the metabolism, fat oxidation, and insulin sensitivity, while NAC helps mitigate oxidative stress, which reduces the risk of metabolic disorders. Okay. And finally, our last supplement that I want to talk about is berberine. Okay. So berberine is a powerful bioactive component that's found in coptis, Oregon grape, golden seal. You guys always probably hear me talk about take something with berberine if you have a bacterial infection. Take something with berberine if you have diarrhea or a runny nose. We're trying to dry it up, right? It can make you too dry, in which case you need to worry about constipation. But there's also some other effects that berberine has in the body. So I just wanted to really talk about how effective this is. There is Integrative Therapeutics has 90 caps for $18 for members, okay? So metabolic health and blood sugar regulation. If you are one of those people who is teetering on a 5.6, 5.7 hemoglobin A1C, or you've got high fasting glucose levels, you are diabetic already, then, and maybe high insulin levels that we've drawn for you, we want to think about berberine, okay? Because its effect on the blood sugar control and insulin sensitivity is exquisite, okay? It reduces blood sugar levels by activating AMPK, okay? This is a process in the body that allows us to lower blood glucose levels and regulate energy production. And of course, it will lower your hemoglobin A1C if it's lowering your blood glucose level. It's also helpful in weight management. What about cardiovascular support? It lowers LDL cholesterol. So if your LDL cholesterol is over 200, or you have a primary care provider who's harassing you for an LDL of 100, you can take this, although we don't want to lower LDLs very low. It can reduce triglycerides. Triglycerides are those fatty acids that are made from eating white food products and sugar, not really from fat in our body as much. It can increase our good cholesterol, our LDL, can regulate our blood pressure and improve our heart function. It's even been shown to have a positive impact on arrhythmias, okay? Anti-inflammatory and antioxidant, okay? So it inhibits pro-inflammatory pathways. It reduces oxidative stress, okay? It increases the activity of glutathione. Here we go. There's glutathione again, right? It supports joint health by reducing inflammation. It can be beneficial for people with arthritis, autoimmune disease, and chronic inflammatory conditions. It is antimicrobial and antifungal, okay? That's what I mentioned before. So it's good for treating gastrointestinal infections, skin infections, urinary tract infections. Berberine is effective against a wide array of bacteria, including H. pylori, E. coli, Staph aureus, and Salmonella. It's antifungal. It can combat candida in the body. It's antiparasitic. They've been using berberine to treat protozoal infections and giardia, and it's antiviral. It's less studied there, but berberine does have antiviral properties. Okay. Also, gut health and dysbiosis. If we've got a lot of bugs in the gut, then we want to use berberine, and we'll talk later about biocidin. Biocidin does have berberines in it. It also supports gut barrier function, liver health, and detoxification. It reduces fat accumulation in the liver, so we don't want fatty liver. It really helps with that. It enhances liver detoxification and protects against liver fibrosis. It also helps with weight loss and fat metabolism and hormone balance and PCOS. There it is again. Okay, so those are the 4 supplements that I wanted us to rethink. Now I just want to throw out a little idea to you all about women's hormones and vitex. So I'm just going to pose the question, what if every woman was on vitex? Now I don't think every woman needs to be on vitex, but I will tell you what, in order to make progesterone, which is the hormone that bottoms out after ovulation and makes a lot of us feel crappy in the period before we start bleeding, in order to make that progesterone, we need pregnenolone, okay? Now, if we are dealing with stress, if we are dealing with emotional stress, physical stress, being sick, natural disasters like Hurricane Helene, we are needing pregnenolone to make our cortisol. And the cortisol will steal the pregnenolone every single time. I have not drawn a progesterone level on a woman that I think is good ever. Okay? Ever. And we take it on day 19 to 22 when it's its highest, and I want it to be 15, and I can't think of a time that I saw someone who was 15 to 30. Okay? So this is really important that we understand that, yes, LabCorp says the range is like 1.2 to 23, but what's important is, are you having the clinical symptoms of PMS? Okay? So what I want to say is that Vitex is a really exceptional way to support our hormones in general, because it works through the brain, through the dopamine processing, and goes down into the reproductive organs and works through the follicle stimulating hormone, luteinizing hormone, I believe. It's not like you're giving yourself progesterone. It's not like we're taking wild yam and giving you progesterone. This is a medicine that kind of rebalances from the top down. And women have told me that their cycles have regulated in one cycle. They've stopped having acne with their cycle. They've stopped having PMS. All of their clinical signs of excessive estrogen have come down. Heavy moons, heavy periods, fibrocystic breast, things like that have changed with Vitex. Vitex is good for if you're starting your period and you're a young woman and your cycle's wacky, if you're coming off of birth control, if you're trying to get pregnant, if you have PMS issues, if you're going through menopause. I mean, we're talking like full spectrum of fertility here. So really, we can get a bottle of Vitex for 15 or 20 bucks for a month's supply, and we can bring ourselves some peace and satisfaction in hormone regulation. So a lot of times when women come to me with hormone problems, I go, well, let's just start you off with some Vitex for a month. It's an herb, and it's just a really beautiful herb from Gaia Herbs that we purchase, and it really does wonders for women. So if you haven't talked to me about Vitex yet and you want to, let's do it, okay? The next thing I want to talk about is internal family systems. I am so excited about this form of counseling, okay? So no longer do we have to sit in front of a counselor and relive our trauma over and over and over and over again. There's actually a truly exquisite pathway to discovering the parts of ourselves that are dysfunctionally trying to meet our needs and failing over and over and over again. And the more we do this, the more we feel bad about ourselves. We're sort of blended with these parts. We think they are ourself, but we have created these parts in our early childhood in order to prevent ourselves from experiencing the pain and suffering that we once did at one point. So I've talked a lot about in my Instagram videos and with patients, like why people don't heal. And that's why I'm interested in the internal family systems work, because, y'all, I can give you every supplement that is by the book, the right thing to help you feel better. But if you have a part of yourself that is blocking you from healing because it has a need that's unmet, or it's trying a dysfunctional way of living with you and getting your needs met, you might actually have a part of you that is actually blocking you and preventing you from healing and finding that wellness. So I'm down this rabbit hole called, how do I help my patients actually heal their minds along with their bodies? Because one isn't going without the other, right? You're not going to heal your body if your mind is in trouble, and you're probably not going to heal your mind if your body's in trouble. So they're married. We have to deal with them together. So Frank Anderson is not the creator of internal family systems, but he is my inspiration, and I am in the process of taking a 29-hour CEU class for therapists on how to do internal family systems work with patients. I do it on myself on a regular basis. Every time something upsets me and I'm like just pushed over my edge, I go and I sit down and I go, what parts are here? Who's here? Oh, so-and-so's angry because they feel shut down. They feel unheard in this moment by this other person. What do you need? What's going on for you? And I hear them and I listen to them. And we talk about, like, could you let go of your old pattern of getting really angry when you're unlistened to and support me in finding new ways of communicating? So I'm simplifying it. The work is highly beautiful and complex. There are lots of people in the area who are trained in this that you can align with as a therapist. I myself am doing it just to support patients in the moment. So you might have me start to talk to you about your parts at some point so you'll know what that's all about. I find it incredibly helpful. So do a little digging and find out about internal family systems as a counseling tool. Also, I have Hurricane Helene on my list of things to talk about, but, I just want to say to all of you and everyone who was affected by the hurricane, may we all grow stronger from this experience. It impacted all of us in different ways. And if it's still impacting you mentally, physically, spiritually, emotionally, reach out and let me know, right? I'm here. I don't often want to spend a lot of time talking about my process with it because I've kind of done it. But I'm happy to share my experience if that helps you. And I'm happy to be here for you if that is impacting your health and wellness in any way at this point. Okay. Also, so as I continue to support many, many people in detoxing mold and parasites and Epstein-Barr and Lyme and so basically like viruses, bacterial pathogens, metals, sorry, my nursing brain, environmental toxins, all these things that we have an assault on us, even like overwhelming emotional states, right? I'm gonna drink some water. These overwhelming emotional states called trauma. All of these things impact our well-being, and we know that, right? So I want to talk a little bit about the cell danger response, because you may or may not heard me talk about this, but people go, well, why am I still so sick? I don't understand. Like, I've been dealing with this bacterial infection for years, or this viral infection for years, or why did Epstein-Barr live in my system and then pop up like 40 years later? I don't understand, right? So here's the deal. One assault on the body, mitochondria turn from power plants to battleships, okay? Battleships come, battle, kill off the thing, make it go away, and we are restored to homeostasis, normal eating, normal sleeping, everything's all good. However, assault 1, mitochondria are battleships. Oh, here comes assault 2, assault 3, assault 4. The battleships are sinking, okay? We are exhausted. We get chronic fatigue. We've got symptoms that come and go. Why am I not getting any better? Sometimes I have a good day, sometimes a bad day. We're stacking up diagnosis. We got autoimmune conditions. We got unknown viruses, parasites, heavy metals, right? It's like it's all stacking up, mold, toxicity, everything. And it's hard to kind of see through it all, right? And it's a big map. I mean, we could draw the connections between all these things and what they cause biochemically in the body. It would be a big map, but it's just very important for you to understand that the cell goes into danger when there's multiple assaults on the body at once. And that's why we're not getting better, because we have to go in and we really have to clear some things out sometimes. And sometimes we have to do some detective work, like, oh, you didn't realize that you had cytomegalovirus or Lyme or Epstein-Barr or mold toxicity or PANDAS, right? Pediatric autoimmune neuroinflammation condition that sometimes comes from a strep infection, right? So, you have to look at all the pieces, and that's where I come in to help you sort of go, okay, well, where else are we not looking, right? So how, like, in knowing that any one of us at any given time could be dealing with some emotional stress and some environmental toxins and maybe a virus that's sort of, gone remote into the body, is like incognito hiding. What are some of the things that we need to do on a daily basis to just maintain ourselves, right? Well, one thing is we just have to look at our symptoms. So if you haven't filled out an NAQ form for me, which is a 300 question, 4-page document where you just circle answers, and you're one of my older patients, please email Christine at Whole Family Medicine and ask her for that, because this is a great way for me to look at all your whole symptom burden again and identify like what part of the body systems might be out of order and what needs some support. Um, it's also an opportunity for us to talk about, like, what does daily detox look like? This is not a heroic, this is not like a heroic detox plan where you're making yourself sick and like purging and like feeling like crap for 10 days and then you're all shiny and bright. No, this is like living with toxins on a regular basis. How are we going to take care of ourselves, right? And this is a big conversation. I'm not going to have this whole conversation on this call because, you know, you guys would be listening forever. Or this it's not a call. We're not on a call. I'm on a video and photo booth that I'm making for you guys. But anyway, so I want to talk about the importance, and everybody knows this, but I gotta like put in my 2 cents here to remind you of exercise and sweating. Okay, you have got to move your body to feel better. You will feel better if you move your body. I don't care what you do. I don't care if you get on a rebounder or a trampoline and you jump around with your kids or you chase your kids around the park, but I need 20 minutes a day from you most days. Get your heart rate up. See if you can break a sweat, okay? If you can't, because you're physically unable due to pain, get in a sauna. Okay, get in a sauna maximum, like try and get 60 minutes a week in the sauna. Get yourself sweating, get your heart rate up. Get in a sweat lodge if you practice prayer that way. You know, you've got to get the heart rate up and the sweat moving in order to keep these things flowing through our body. It's going to support your liver and kidney detox pathways. You got to drink water, right? We want to get a half a gallon to a gallon of water a day, okay? Some people say a third to half your body weight in ounces of water a day. So, you know, if you're 120 pounds, that's about a half a gallon of water a day. If you're more than that, you need more. Yeah, so sweat, cardio, exercise, okay? If you think you can't do it, just go to YouTube and find someone. I like the lady on Growing Ananas, Anannas. It looks like asanas, but it's ananas because her name's Anna. And she's German, and she does like a 20 to 30 minute high intensity interval training workout. I don't care if you do 1 jump squat for every one of her 10, or if you don't even jump and you just do a little squat, right? I don't care if you get on your knees and do the push-ups. I don't care if you do the jumping jacks, you know, without jumping and just moving one leg or the other. But whatever it is, like, we have got to move our bodies. And if you're not and you can't find 20 minutes a day, then let's talk, because I'm here to help you. I do it in the middle of the kitchen while my kids are eating breakfast in the morning, okay? They try and talk to me. It's obnoxious. This is when I have a chance to do it. I get it done, right? And so to me, this is like the little things that we can do to make the difference in our healthcare. The other thing is, you know, if you're over 40, you're not getting any younger, and all it takes is an injury to your body to set you back and get weak, and you may have trouble getting up off the floor after that, okay? So we want to keep our body strong and toned, keep our core strong, have lots of practice getting up and down, because I know, like, I worked with people in their 70s and 80s. Like, you can do it really good, and you can be stuck and immobile. So we got to keep moving. And also for women and men, bone density issues. Impact of, you know, doing things where we have impact to our body. It doesn't have to be jumping, but like using our muscles, that creates bone density. And we don't, as we know, as we lose our estrogen after menopause, our bone density goes down. So we got to continue to build our bone density and our muscle health, okay? So something else for big picture, just like once over or once a year, annual labs, okay? I have a $90 packet. This is a ton of labs, right? So what's included in this is going over here to the list of the whole family medicine labs. So, you know, if you went to any lab test now or whatever, you'd probably spend like $500 on all these labs. But I have such a great discount with LabCorp that we can get a ton of labs. And what I can do with labs is so different than what most Western practitioners do with labs. So I can take these labs and I can get so much information out of them. Oh my gosh, I think I just deleted them. Yeah, they're not, the list isn't there anymore, but I can send it to you. It's hemoglobin A1C, vitamin A, vitamin D, all the thyroid labs. It includes markers of cardiovascular health, all of the cholesterol labs. It looks at your liver health. It looks at your blood count. It looks at, I mean, and even labs that aren't identified this way will guide me to know if you are getting enough protein, if you have leaky gut, if you have inflammation in the body that we need to recognize, lack of B vitamins, things like that. So for $90, for the first year, a lot of things I'm not going to have you repeat. Like if your thyroid is golden, I'm not going to check your thyroid every single time. But it's a long list of labs. If you haven't done a set of labs in the last couple years, please reach out. Let's take a look at how things are going. This is the best way for me to help you optimize your health. Getting a set of labs this year is the best way for me to help you optimize your health. Okay, we are going to be able to see all kinds of things that we can prevent or help not get worse or celebrate that are really good. But this is the best way for me to help you with your optimization, is to just get $90 in labs. And then I just want to take a second and talk about more targeted detox protocols. Many of you have been working with Biocidin with me and Christine over the past year. I just want to talk about the digestive system real quick, because if you haven't been blessed to hear me talk about it, I can go on and on and on, but I just want to take a second to share with everyone. So how this starts, right? Like what's going on in the digestive system and where you can have dysfunction and what it can look like and why you'd want to consider doing a gastrointestinal microbiome reset. Okay. So number one, you put food in your mouth. You have to chew it. Are you rushing? Are you focused on something else? Are you in a place of gratitude? Are you stressed, right? If you're stressed, guess what is not going to be getting blood flow? Your gastrointestinal system. When you are stressed, the blood flow goes to your heart, your lungs, your muscles, your brain. You're in fight or flight. If you are in parasympathetic, rest and digest, you're getting blood flow, and all of the hormones involved in your digestive system are going to be aligned and working well. Okay, so you chew your food, you chew it well, you start to break it down. There are some salivary enzymes. You swallow your food, it goes down into your stomach. Do you have enough hydrochloric acid, right? Many of us don't. If you suffer from acid reflux, from GERD, from, peeling fingernails, not being hungry in the morning, these are just a few things. You could have low hydrochloric acid, okay? Bloating and gas directly after meals. Not enough hydrochloric acid, because you know what happens? This bolus of undigested food, because you didn't have enough hydrochloric acid and maybe you didn't chew your food very well, drops into your duodenum, which is the beginning of your small intestines, okay? And that is where, if there is an acidic bolus of food, if it's acidic, then it will say, hey, pancreas, come secrete your pancreatic enzymes. Hey, gallbladder, I want some of that bile, okay? So, but if it's not acidic enough, the pancreas and gallbladder aren't going to come play. So now you're not breaking down your proteins, you're not breaking down your fats, and you didn't break down your carbohydrates. So now you've got a pile of undigested food in your gut. Well, that is a foreign invader. So that's going to cause your immune system to go on defense. So you're going to have inflammation. It's going to cause irritation to your gut lining. Your gut lining is going to get all inflamed and mad and irritated, okay? Because of that and the lack of hydrochloric acid, you're more likely to get parasites, because you won't kill the eggs when they land in your stomach. You're more likely to get dysbiosis in the gut. That means that the bacteria in your gut will not be good bacteria, it'll be bad bacteria, and the good bacteria won't have any room to grow. Okay, you can also end up with candida in this situation, and mold likes to eat your undigested food. So mold will make these little food pockets called symplasms, and they'll go into, they will be like little food pockets for the mold for later. And guess what? Parasites like to eat those too. So then you've got this whole feast of all of these pathogenic species in your gut having a party. You're probably feeling like you're not digesting your food, or you're fatigued, or you're having attention disorder things like brain fog. Children might have behavioral issues like high irritation and things like that. Let's see what else. You could have constipation, diarrhea, gas, bloating, any kind of GI symptom that you don't like could be related to this issue, right? And then all this stuff is moving forward and you're getting leaky gut because your gut is inflamed and all those proteins are leaking out. Maybe you're having joint pain. Maybe you're having muscle pain. So do you see the picture? It's a big map, right? And so that's why we've done Biocidin for a long time, which is a liquid, highly concentrated herbal product that goes in and it kills bacteria, mold, yeast, parasites, etc. And there's a binder you use at night that pulls all of the junk that it's killing off out of your body so you don't have to suffer. Sometimes we use products to kill viruses that might be co-infections. Sometimes we use spore-based probiotics to recolonize the gut. And so that's kind of how Biocidin has worked up until this point. We also have a new product line that recently bought Biocidin, or new to us. Cellcore has been around for a long time, but they got my attention when they purchased Biocidin, because I was like, I've been using Biocidin forever, and I know Cellcore, and I have an account with them, but their products seemed really overwhelming to me, and like less openly herbal, more like just like bottles that weren't like, oh, here's all the botanicals in there. It was more like, well, this is for parasites, and this is for this. It's just a different approach, right? So Christine and I got on the call with Rob, our rep from Cellcore, and had some really inspiring conversations with him. And so Cellcore goes beyond just the gastrointestinal tract and into the liver, into the kidneys. They've got a liver product that can dump liver flukes out of your liver. They've got really potent parasite products. They've got products that work against Lyme, which Biocidin does as well, but they have some Lyme-specific products. They have products that, the way they start everything is an energizing package. So like basically you're optimizing your mitochondria, because go back to that cell danger response that I was talking about, and we've got like in any problem, you probably have malfunctioning mitochondria. So they're going to give you everything you need to get your mitochondria on board. And then from there, they're going to go, we're going to work on the gut. We're going to work on the parasites. We're going to make sure they're pooping. We're going to make sure that the gut is open. We can detox that way. And then we're going to move to liver and kidney. We're going to do liver and kidney. We're going to do lymphatic. We're going to work on heavy metals. We're going to work on pesticides, even glyphosate. We're going to work on, we talked about parasites. We talked about Lyme, co-infections, Epstein-Barr, herpes, things like that. So Cellcore, I would say, is like awesome, and Biocidin's awesome, but Cellcore is like a little more complete. And they have a foundational cleanse that is like $580 for members, and it's like $1,000, $800. I give 15% off of the wholesale, of the retail price to our consultation members. Okay, so again, benefits of membership, you get lots of discounts on your supplements. And their foundational product, the foundational program is a 4-month program, and then their comprehensive cleansing program is a 9-month program, and it is like $1,600 for members, and I want to say it's, I don't know, $2,500, $3,000 for non-members. But again, this is for those of you out there that are like, I can't figure out how to get better. I have chronic fatigue. I have, it seems like the whole world is closing in on you. That 9-month program is for those of you who are curious, who have the cash to pay for it, or for those of you who are just like, I really need something. I really need it to be something, right? So, those are all the things I want to share. That is so much. I probably talked for an entire hour. It looks like I did, about 43 minutes. Hopefully you guys are still listening. Hopefully you will contact Christine and Ivy and I to get some visits in, talk about these things in the new year. Again, I just want to review myofunctional therapy. Don't forget about the importance of how your mouth functions. And supplements, we talked about saccharomyces boulardii, melatonin, and acetylcysteine, and berberines. We talked about what if every woman was on vitex. We talked about internal family systems work and how people can heal their minds by separating their behaviors as parts that are dysfunctionally trying to help them and finding ways to free up that energy so that they can be functional adults without these childhood parts still running them. And daily detox, the importance of just give me 20 minutes a day. I want to see you sweat. I want to see your heart rate get up. It's gonna be challenging. It should be, but it doesn't have to be too much. You set the pace. Annual labs, $90, gets you a whole lot of information. And if you haven't ever done the NAQ, we want you to do it. We talked about the cell danger response and why people get sick and get stuck in that, especially with the GI microbiome. Also kidney, liver, lymph, congestion of heavy metals, mold, all these things. And also, if you're in any kind of detox protocol, this sweating and exercise is going to help you. So, love you all very much. Really happy to be your healthcare provider. Thank you all for spreading the word. I almost never get cold calls. People come to me because of what you say about me. So I'm glad I'm able to serve you in a way that feels good. I am very humbled by the wins that we have, and it really brings me a lot of joy. And may we grow and prosper in our mind, body, and spirit, each of us this year of 2025. May everyone be well and feel well mentally, emotionally, spiritually, physically, and we're here if you need us.